What is the best kept secret in the United States? I've worked clinically as a doctor for 35 years helping individual patients, and then I came to see that the health of whole communities really mattered more. So I want to speak on this meta level, linking societal health to rights we hold dear in the Declaration of Independence. Life is the most common sexually transmitted infection. It is 100% fatal. There's no cure. How are we going to treat this chronic infection called life in the United States? The Declaration of Independence entitles us to life, liberty, and the pursuit of happiness. Do we enjoy these rights today? Do we have justice for all? What I'm going to say suggests that over the last 35 years, we've made choices that have limited the potential health benefits that we can see. We spend half of all the money spent worldwide on healthcare, most of it in the last few years of life. We go bankrupt trying to pay medical bills. Those looking at healthcare reform were outraged that the government was going to pull the plug on grandma. To us, health means living as long as possible. Are we successful? If you go to the Central Intelligence Agency's world ranking for length of life, we stand 49th among nations, behind Bosnia and Herzegovina and ahead of Albania. We live 3.9 years less than the healthiest nation, Japan. How big is that gap? If we eradicated our leading killer, cardiovascular disease, the condition that will kill roughly half of us in this room, we would gain about 3.5 years in life expectancy and still not be the healthiest country. Earlier this year, the National Academy of Sciences released a report in Washington, D.C., released a report showing that for those of us age 50 and over, our length of life has been declining compared to other countries, and we used to be one of the healthiest countries for that indicator 60 years ago. In fact, in almost a third of American counties, life expectancy for American women is declining. If there were an Olympics event, we wouldn't be there for the final day's races. We would have been disqualified in the trials. If we'd done so poorly in the Beijing or Vancouver Olympics, we would have fired the coach long ago. What about the quality of our shorter-lived lives? Well, the Declaration measures of happiness and well-being have been declining in this country for the last 40 years. And once again, women have shown most of the declines. Our Declaration of Independence only entitled us to pursue happiness. And the fact that we consume half of the world's Prozac and related antidepressants suggests that our health and well-being is not doing so well either. Our shorter-lived lives are not happy ones. We believe that if we don't smoke, exercise, eat right, and wear a condom, we'll enjoy the best health possible. But most of the longer-lived countries smoke more than we do. That fact that we smoke less than people in longer-lived countries made me look at these issues of what produces health in society. What we find is that they matter much more than what individuals do or don't do for their health. The odds of any one of us living a healthy, long life in the United States are less than over 25 countries. Even the healthiest cherry-picked American populations don't live as long as entire nations. What matters most in producing a healthy, long life is the nature of caring and sharing relationships in society. These matter more than whether we exercise, don't smoke, or how we eat. Caring and sharing is closely linked to the economic gap between the rich and the poor. Our economic gap has reached record levels over the last 35 years as the wages for the richest 10,000 Americans have ballooned, while the rest of us have had to borrow our salaries from home equity and credit cards. Healthier countries have a smaller income gap and create societies where economic justice prevails, and they take care of everyone there with generous policies subsidizing transportation and housing, and family benefits allowing parents time to raise healthy children. They recognize that they're in this together and don't tolerate poverty the way we do with our you're on your own mentality. Over 200 studies demonstrate the greater the income gap, the worse health becomes. A higher income gap makes us toil as we work harder to live and to acquire stuff that doesn't make us happy or healthy. Stress, this causes stress in our lives, and stress is the 21st century tobacco, another secret. A third of deaths in the United States can be linked to the high income inequality that we have and the stress that produces. So to create a long and healthy life, we're going to narrow inequality. President Franklin Delano Roosevelt proposed an economic Bill of Rights in his last State of the Union address. Dr. Martin Luther King Jr. preached the same in his final years. President Nixon proposed a guaranteed income for all American families in 1969. If we want to be healthier, we're going to have to revisit policies proposed by both Republican and Democratic presidents that would produce health through economic means. The medicine that will heal us is a healthy dose of Robin Hood. We need to take from the rich the trillions we've given them and that really belong to all of us. These rich have taken the trillions and paid themselves fat bonuses of what should belong to our grandchildren. And what about our grandchildren? Studies show that half of our health as adults is programmed between conception and the first couple of years of life. That matters as much as everything that follows. So early life impacts a lifetime, another secret. Most pregnant women in the United States face stressful circumstances that produce worse outcomes in their infants as they grow into children and become adults. Infants and children no longer enjoy a single caregiver, as most moms and dads have to work. That wasn't the case when we were one of the healthiest nations. Most rich countries give paid prenatal leave. Almost all countries give paid parental leave. We do not. Parents need time to produce healthy adults. If we create caring and sharing circumstances in early life, then we won't have all the problems that require so much expenditures when these children become adults. We need to provide these health-extending benefits in early life. Instead, we have an economic system that fosters greed, creating stress that heralds untimely deaths. If we all knew the secret of dying young, would we continue to tell everyone to have a nice day? Once we know, we're inviting the Grim Reaper to come years too early. We will return to the kinds of conditions that fostered good health in this country 60 years ago. Inequality kills. It begins by creating stress in early life that plagues us all through adulthood and leads to an untimely death. We need to work for a fair and equitable society and get the better, longer health that we deserve. Leak these secrets to everyone. Thank you.